So a lot of the strategies I'm going to talk about today come from the ideas that we use within my practice, and also within the book that I have just written and is coming out in a couple of weeks. It's actually based on adult ADHD, but the intervention that we use in our practice started out at Florida State University working with college students with ADHD down there and executive functioning problems. So if anyone is interested in any of this stuff, it's written as a self-help book, but really a lot of the ideas can also be used on the other end if you have clients that deal with some of these issues. So I do have some more information on that over here, some flyers as well as some more information on my practice that you're welcome to pick up at the end. So as Kelly was saying, we work with individuals. We also often work with parents for a couple of reasons. Sometimes, the apple doesn't fall far from the tree. So a lot of parents are often struggling with the same issues as their kids are. And sometimes you'll get those parents with a little bit of a fix my kid mentality, and you really have to educate them a little bit on things that they can be doing to help support it so that everything you're setting them up with doesn't get unraveled when you send them home. We also offer testing, which, as you probably know, is a very important piece of the puzzle as well. A lot of times there's misdiagnosis, and really understanding a child's particular learning profile is really important, because we don't, for example, want to set up a child that learns well visually with a study system based on auditory processing. We want to base them up with based on visual learning. So you really want to get a good understanding before you make headway on any of the things I'm going to talk about. So I wanted to start by defining executive function. And it's a really difficult thing to do. There's a lot of definitions out there. A lot of the definitions actually just rely on lists and are more what are the executive functions rather than what is executive function. So I'm a big Russell Barkley fan, and he defines executive function as those actions we perform to ourselves and direct at ourselves so as to accomplish self-control, goal-directed behavior, and the maximization of future outcomes. A lot of this is along the lines of what's called self-regulation. So the ability to self-regulate ourselves and plan and organize and maintain a behavior towards goal-directed behavior. Maintain it. A lot of disorders have executive functioning as the core component at the forefront. I work a lot with ADHD, but we also see a lot of autism spectrum disorders, other learning disabilities, even traumatic brain injury, OCD, depression, schizophrenia, Tourette's disorder, drug and alcohol abuse, and dementia for older patients. So it's a cornerstone for a lot of different disorders. And what I want you to do as we go through this is I want to challenge you to take either your PowerPoints or some notes and think of, I know everybody here works a little bit in different capacities with it. So I want you to think about a case that you might work with. And as we go through this, kind of try to develop some ideas around that particular case to make it personal for you. So another way to think about executive function is as the brain CEO. We think about the way an executive might function. It makes a lot of sense. It's really aptly named, which is nice because a lot of things like ADHD are not named so well and don't really define things. So some of the examples for PowerPoints, I guess, are coming around for those of you who need them. Some of the things specifically in that kind of bucket list that I was talking about that we use to define executive function are things like disorganization, difficulty getting started and finishing work, remembering homework, difficulty memorizing, writing essays or reports, complex math problems. Math is the most complex. We have to use a lot of different systems and integrate a lot of information at the same time. Remembering what is read, completing long-term projects, being on time, controlling emotions, which sometimes people forget about too. There's an emotional self-regulation that goes along with it. This isn't just things that have to do with academic skills and planning for the future. So this is kind of a breakdown here of the different categories we think of, again, in executive function. I'm not going to read all of these for you, but I will read the headings. We have working memory, which is the ability to take information and hold it while we work out a problem and use it towards something. Activation, arousal, and effort. Controlling emotions, as I just mentioned. Internalizing language, so using that self-talk to kind of direct and control our behavior. Taking an issue apart, analyzing. Shifting. You probably see a lot that these kids have a lot of trouble changing from one task to another, that can often cause a lot of discomfort and arousal. Organization, planning ahead, and then self-monitoring. So this can happen in blurting out things that they don't mean, or speaking out of turn. I just wanted to briefly read this real-world impact here, one mother's account of realizing some things about executive function and her child. She said, although our son Alex successfully struggled through the early school years, he finally hit the proverbial ADHD brick wall in middle school. Belatedly, I realized that the demands for his executive skills increased exponentially in middle school, and sometimes you'll see this, then in high school you'll see another change where they might have difficulty, and then again we see it often in college. As a former teacher and school psychologist, I'm also embarrassed to say I failed for many years to recognize that a high IQ score alone was not enough to make good grades. It wasn't until Dr. Barkley identified the central role executive function plays in school success that I finally understood why school was so difficult for my son. Teachers would say, Alex is very bright. He could make better grades if he would just try harder. In truth, our children often do try harder, but then cannot make good grades without proper treatment and academic supports. Bottom line, the executive function deficits were the primary cause of Alex's academic struggles, not the symptoms of his ADHD. Does that sound familiar to anyone? Okay. Okay, so what I really like to do in my talks is give you some real strategies. And again, I know everybody here works a little bit differently, so this is going to be coming from kind of a therapeutic coaching mentality. But what I'd like you to do, again, is think of your case and try to place a child that you work with in this scenario and utilize the strategies that I'm going to talk about here for that child. So the 4 strategies that I'm really going to focus on are goal setting, organization, time management, and study strategies. So we're just hitting on a few of the executive function deficits here. Okay, and I have a little quiz here. So I'm going to have a quiz at the beginning of each section, and I just want you to answer the questions. So your client would be whoever it is that you're kind of thinking about, and try to think of someone that may meet some of this criteria. Does your client have abstract ideas of what they would like to accomplish, such as I would like to be better organized? I'll tell you why that's really abstract in a minute. Is your client the antithesis of the old Nike slogan, just do it? Does your client alternate between going full force towards a goal, so this is a kid who's making 100 flashcards for a 10-minute quiz, and then undoing everything they set in motion, they're forgetting to actually study the flashcards? Is your client's backpack littered with crumpled to-do lists or notes meant to keep him on track? And does your client get down on himself because everyone else seems to be reaching their goals except for him? Okay, so let's talk about goal setting. And when I'm talking to families and clients about this, I use the analogy of building a house. A lot of these kids, because they don't have this ability to plan and organize, they want to go kind of from 0 to 60, and they don't understand the beginning steps towards that. And then they get frustrated when they can't get to that final step fast enough. When building a house, you don't want to start putting up walls and lights and fixtures before you get a good foundation. So what we really want to do here is build a solid foundation for that goal so you know what we're working towards. So that's what we're going to do first. We're going to create long-term goals. That's what I call a long-term goal. And long-term can be anything from, I don't know, 6 weeks to 6 months or so. It's not so much based on the time as it is the fact that it's kind of an overarching idea of what you're trying to achieve. Then what we're going to do is work with the client to break down those goals into small weekly objectives. And then what we want to do is we're going to work with incentives, rewards, and consequences. Now, with executive functioning deficits, this is really important. Because of that issue with self-regulation, they really don't have that internal ability to self-monitor and say, you know, I'm going to work towards this goal just because that feeling of that job well done is enough to motivate me through. Instead, you kind of have to use a little bit of the carrot and stick approach. You need to externalize the self-regulation process. And then eventually over time, it does become a little more internal when they do get those feelings of pride and it feels good and mom and dad are happy. But using those incentives is really important for that self-regulation, self-monitoring. Fourth is metacognition. And metacognition is really defined as thinking about thinking. So this process really needs to be conscious because if you just have a reward system or a token economy or something like that, and the kid goes through and they're meeting their goals, that's great, but at some point it needs to become a process that they're aware of, and especially as they get older and older. So they really need to talk through and understand the things that are motivating them and what is working for them and what isn't working for them, and it needs to become a conscious process. So I have kind of 3 golden rules when creating a long-term goal. And again, we're thinking about a foundation, thinking about structure. This is really important to get this piece right. So think about your client as we do this, and what I want you to do is kind of try to create a long-term goal for them. This is going to be similar to if you're creating some sort of treatment plan, but probably a little bit different. So the first part is to make it measurable. This is pretty straightforward and understandable. So measurable just means, do you remember my example of I want to be better organized? So that was abstract because we can't measure it. You know, if I say I want to be better organized and I'm doing everything I can and I'm working with one of you and trying to get better organized and 6 months goes by and I think I'm better organized, but how do I really know? So we need to make it measurable. I'm going to skip down here to number 3 because that one's a little more easy to understand too. That's time sensitive. You gotta have a due date, you know? I mean, if you have a paper to write and there's no due date on it, what's the likelihood of it happening? So that same goes with goals. You have to have a date in mind of when that goal is going to be accomplished. And now the third one, which is actually number 2 here, is making it process-based. And this one is about, so process is going to be rather than outcome. So if you have an outcome-based goal, which unfortunately in school, a lot of our stuff is outcome-based, so getting an A. Okay, now that's great, but what happens, especially with these kids, is they can work really, really hard sometimes, and they can put forth all their effort, follow through with the plan, and maybe, you know, the test was just harder than they thought it would be, or for some other reason they don't get their A. Well, it's very disappointing if you've done everything you possibly can do and you don't get the grade that you want to get. So instead, we want to make the goal written in a way that it's based on their behavior throughout the process. And hopefully that will get you towards the outcome that you'd like. But if it doesn't, you can still feel good about it. So in terms of studying, it might be to create and follow through with a study schedule. And then you've done it. Hopefully, like I said, you get your A, but maybe you didn't. And that's okay too. So we want to make it based on the process. So these are four ideas here of really common things that people come to me with, and turning it into what I call good quality long-term goal using the 3 golden rules. So here, think about something somebody's come to you with, a child with executive functioning problems, and kind of the abstract overarching idea of what they might like to accomplish. Things like, I want to be better organized, I want to manage my time better, I want to be less distracted, or I want to be a better son, daughter for my parents. Now using the 3 golden rules, we switch these to, I want to create and maintain a system of organization for my desk over the next 3 months. So it's specific, we've got a timeline, and it's based on the process that they're doing throughout. The other thing about process is some of these kids have really mastered that art of procrastination. So while I said it can be disappointing if they do everything right and don't get the outcome they like, it can also happen in the reverse. So they can procrastinate, and if that organization goal was just written that they had to, get it organized by 3 months from now, then they could wait until the last minute and still manage to get it done. And they're like, oh, great, I met my goal. But we don't want it to be like that, because as they get older, it's going to get more stressful, and they're not going to be able to maintain that. So I want to manage my time better turns into, I want to utilize an agenda to record my schedule on a weekly basis, then follow through with the schedule for the next 8 weeks. I want to be less distracted turns into, I want to research and attempt 1 new skill per week to help increase my ability to focus for the next 5 weeks. And then wanting to be a better son, daughter, how do we define that? That turns into, I want to dedicate 1 hour per evening to bond with my parents for the next 2 months. Can anybody think of something on this side of the screen here that maybe you wouldn't be sure how to turn into a quality goal over here?
Increasing motivation.
Okay. I want to increase motivation. Does anyone want to take a stab at applying the 3 golden rules to that? And there's lots of ways, there's no one right answer. Yeah.
I will set up some things I want, or that I want to get. Things and rewards, hopefully more.
Yeah, you're on the right track there. Okay, so she said that I'm going to think of some things that I'd like to work toward or have or gain, and then I'm going to set them up as rewards for myself to get things done. So that's exactly on the right track. We have the specificity there. We have it pretty much based on the process if you're using that over time. The only thing I would add there is, picking a definitive due date, but that's a great example. And I'm going to talk along those lines right in a second. That was a great segue, so we're going to talk about rewards and consequences. So what we do in our model is after we've created those long-term goals, we actually set up a corresponding reward for each of those goals. Then on a weekly basis, as we're working to break down those goals stepwise, we're creating kind of mini rewards and mini consequences to go along with that. And that's the part that increases the motivation. Motivation is a real cornerstone for all of this. So you can't expect, just because you've created a good schedule of how to study and break down or broken down a paper into steps, that the kid is necessarily going to do it. Again, that's self-regulation. That's not going to be enough. And in fact, a lot of these kids have very high IQs and are very intelligent, and they kind of know what to do. So the motivation piece can be really huge. It's just getting them to do it. So factors to consider when you're creating a reward or a consequence with a child. Be complimentary. I find that the most successful rewards and consequences are those that kind of are a little bit affiliated with the goal that they have in mind. So let's say somebody wanted to eat nutritiously. It was a nutrition-based goal. Well, then maybe the consequence would be to drink a glass of milk for a kid that really doesn't like milk but knows it's really good for him. So it's still kind of encouraging that goal, but it's something they really don't want to do. Or if they do meet the goal, they get to eat something really healthy but delicious as well. They get to go get frozen yogurt or something like that. We have, this is probably for a little bit of an older kid working on kind of finances, but I've had kids that for spending related goals, they'll say, well, if I don't meet my goal, I'm going to give my allowance to charity. So again, it's related, it's complementary. It's also kind of doing something good, and it makes the most sense. If you do something that's completely unrelated, it just doesn't really make a whole lot of sense. The sooner the better. This one is imperative. If you delay a reward or a consequence, even by as much as a day, it's not going to be motivating for that child. So the consequence and the reward need to happen as soon as possible in relation to whether or not that goal has been met. So you're not going to go to the movies Friday night if you study for your test Tuesday. You're going to pop in a DVD and watch it that very night. Get creative. It's, you know, the obvious ones kind of are, oh, I get to use my cell phone, or I get to go out with my friends, or I get to go on Facebook. But sometimes these kids can get really creative, and it makes it a little bit more personal for them, and they have a lot more fun with it, and it usually accomplishes the goal a lot better. I've had girls that will say, if I don't accomplish my goal, then the next day to school, I have to wear mismatched clothes and no makeup. And that one works really well. So getting kind of creative and fun is really valuable for the reward and consequence process. And then try both and then use what works. I always have kids to try adding a reward and a consequence. But one disclaimer is that I do find that kids that have really high anxiety or depression sometimes, most of the time the consequence is kind of just too much for them. They already feel like they have enough consequences, they're already down on themselves, and even sometimes the reward can feel like just another thing I have to do. So you really have to pay attention to that individual. And make sure you use what works for them. And then some people are just more motivated by one or the other. Keep in mind that this isn't a bribe. This goes back to what I was saying about that carrot and stick and the fact that these kids are really behind, you know, even maturity-wise in terms of their brain development and self-regulation. So it isn't a bribe when you're saying you get a reward like this. If you're helping to internalize that self-regulatory process. I'm not going to read all this, but this is just the overarching idea about metacognition, the thinking about thinking. And what we would do in the coaching room is that we would say, okay, if you met your goals, why were they met? What helped you to succeed? Was it the reward? Was it the consequence? Was it the fact that, you know, your mom was just really happy with you, or was it the fact that we did have a well-laid plan? What worked for you? If it didn't work, what didn't work? What do we need to change? If the rewards weren't, if they did it and the rewards weren't carried out, well, what happened there? So it's all about the process of, once they meet the behavior, figuring out what's going on underneath and what's really motivating them there. Okay, let's move on to getting organized. So is your client constantly losing or misplacing everyday items such as her keys, cell phone, iPod, or wallet? Does your client forget what color the top of his desk is because it is constantly covered in clutter? Does your client insist that something was never given to her, only to find it weeks or months later? And does your client's closets look like a bomb went off? Does your client start to organize his room only to become overwhelmed and or distracted? Sound familiar? All right. Maybe in your own homes. All right. Okay, so I like to break organization down into 3 steps. There's the before, the during, and the after. The after is a lot of times the hardest part. So one thing to keep in mind is that it's progress, not perfection, and that your goal should be to create and maintain a system that you can manage with relative ease to simplify your space. Okay, I use relative ease because a lot of people think that, you know, it needs to be this perfect way all the time, but there's going to be good weeks and there's going to be bad weeks. So you need to have that understanding right up front. And I'll actually have clients write the phrase progress not perfection on post-it notes and kind of post it around as they're doing the work so that they keep that in mind. The more planning and preparation you do, the less stress and time it'll take. Again, this is kind of in reference to the fact that clients often want to just move on and get started, but we really need to, again, set that foundation in order to reach that goal. I have this little checklist here. Again, I'm not going to read the entire thing, but this is just something that I like to have people do before they get organized. Again, so people usually are just eager to get started, but really if you set them in a good space before doing it, you're going to have a lot more success up front. So in the book we have a lot about fears, and sometimes there's fears of success, there's fear of failure. So sometimes a lot of people are resistant to doing some of these things because of the fear that they're holding on to. Progress, not perfection. Resisting the urge to try to organize everything at once. And I always say to people, you know, it's been this way this long, you know, it can go a week longer if you don't have, you know, all of the areas that you want to have organized. And then create a list of areas you'd like to organize and number them from most important to least important. Prioritization, really important as well. And figuring out motivation. Okay, so I just have a couple of rules here that I just wanted to go over. Now some of these are more applicable to the home, some more to school, you could use in school. But again, just think of how you could kind of alter what I'm saying here to your particular situation and how you might be able to utilize that. The keep, throw, or donate rule is just kind of a three-tier rule, and it can have, you can use boxes, you can use piles. So this can be used to clean out a child's desk in school. It can be used to clean out a room at home. But essentially, you're going through and you're saying, is this something that I need? Do I throw it? Or is this something that I want to give away? You know, maybe I have an extra pair of scissors and somebody else in the classroom can use them. Divide and conquer is breaking down into small steps. And this can be done in a variety of ways. I've had people divide different areas. So let's say a locker, for example. They can say, well, you know, today I'm just going to concentrate on that upper shelf, and I'm just going to get that where I want it to be. Or today I'm going to concentrate on that pile that's at the bottom of my locker. I've also had people do it in the home, let's say a playroom or something like that needs to be organized. I've actually had clients take string in a big room because it was so overwhelming to look at and divide it into grid lines. So they actually had different corners of the room, and they would only tackle one at a time. So any space can always be broken down into smaller spaces. If you have a child that doesn't want to organize their whole backpack, say, you know what, just concentrate on that first pocket for me. Let's just get that first pocket done. Then you'll often find that once they do get started, it's a lot easier to keep going. Photographs are really helpful, especially kids that are very visually oriented. They're helpful in a couple ways. One, they can be reminders of what a space is supposed to look like. So once it gets organized, you take that picture and you put it on that space. Closet door, maybe it even gets pinned to the backpack, I don't know. But have a picture of it as a reminder of what it needs to look at. It can also serve as motivation, because the child sees, well, I did this once, and as it starts to get a little bit messy again, they pull it out and they say, you know, I can do this again. I did it once. This is what it looks like. So I have kids take a lot of pride in that picture. Picking a spot, you might have heard this one before, but basically the more areas that you can come up with a spot that it always goes in, and the more routine you can make it, the more consistent they will learn to be with that. So organizational systems that you can get, dividing areas, even dividing within a desk or a locker, different folders in a backpack, picking a spot, and making it as simple as possible. I'll have kids for papers that need to go into the backpack, instead of having to open up their entire binder and file it into the correct class, they just keep one little manila folder that just opens like this, and it says to be organized. And they just have to stick that paper in there. Then when they go home, they can open it up, put it in the correct place. But a lot of times, if you don't have something like that, where does it get put? In the bottom of the backpack, right? And then it gets turned into a crumpled piece of paper that you might never see again. So the more simple you can make it, the least amount of effort that they're gonna have to take in order to preserve it, at least, and be able to find it later, the better it's gonna be. With that idea, insight in mind. Now, I always say that these kids would do the best if you could just make everything out of plexiglass and their backpacks were just clear plastic. But unfortunately, you can't do that for a lot of things. So the more containers that you can have visually just right there, again, easily accessible, the more successful they're going to be. So a lot of times I won't even have kids file into a filing drawer. Instead, I'll have them do kind of lateral files on top of the desk or something like that, where it's really going to stick out of them. And these are just some brief ideas in order to help with that difficult piece, the maintenance of organization. If they can take a quick sweep at the end of the day, 10 minutes, if you can help them to just have a little bit of time each day to organize, the more successful they're going to be in maintaining that organization. More complex tasks, again, that goes back to routine. The more routine you can make it. So if they can have a designated day to do something. I use here, every Thursday night before dinner I do laundry. Or, every Sunday night I read my history textbook. So the more routine that they can make it, the better. For every item you bring in, one goes out. This can be used in the home, it can be used in the backpack, it can be used in the desk, whatever you can do. Handle it once rule for sorting papers, so teaching kids to be proficient and not say, oh, I don't know, I'll look at it later. It needs to have go in the appropriate place the first time that they hold it. And then keeping small containers where they can just kind of throw items so that they won't get lost, and then knowing that they're going to go collect those boxes later and then redistribute everything where it goes. Again, this could be in the home, maybe even in the classroom, I don't know. But using small containers just to have a place to throw things. Okay, let's move on to time management. And this is kind of another cornerstone executive function, because if you can manage your time better, all the other parts kind of become easier. If you can schedule time to do everything and you can follow through with that schedule, then you're going to be more organized and study better and all of those other things. So the questions here are, does your client put off tasks until an unwanted consequence has them scrambling to get it done, leaving them stressed and regretful? Are loved ones often upset with your client because they commit to doing something and then find they are too busy to follow through? Does your client create daily to-do lists with several items and only manage to cross one or two off at the end of the day? Does your client's teacher have to hassle her to get work turned in on time? Does your client find itself putting off items that should be taken care of immediately, such as homework, to do something unimportant, like rearrange his sock drawer? Does your client feel like everyone around him is getting 3 times as much done in the same amount of time? Sound familiar? Okay. All right, I need my little cheat sheet for this one. So. We talk a lot about procrastination, but it's kind of talked about in one blanket term. And I really think, and there might be more, but I think there's at least 5 different types of procrastination. And it's really important to help the student or client that you have in mind identify the type of procrastinator they are, because what they do in order to overcome that procrastination is going to be a little bit different. So I've, to make it a little bit more fun, come up with some characters to kind of give examples of these types. So Homer Simpson is the ineffective prioritizer. And what Homer does is Marge, his wife, will often give him some sort of task or something to do, and he usually leaves with the best intentions. He loves his wife, but he doesn't really know how to prioritize. And so he'll kind of get sucked into things that are of lesser priority. Oftentimes this means he's drinking at Moe's Tavern instead of doing what Marge set him off to do. So what Homer Simpson types, the ineffective prioritizers, need to do is they need to take the time to really stick with the well-laid plan, figure out what their priorities are, and I'm going to talk about a way to do that, and really stick with that plan. Pooh Bear, silly old bear, is the forgetful type. He does not have a very good working memory. And I have an 18-month-old daughter, so we're reading a lot of this stuff. And in one of Pooh's stories, he and Piglet are going to find a woozle, I think it's called. And it's this imaginary creature that doesn't exist, but they're convinced they're going to go catch one. And so what they do is they set out a jar of honey to catch the woozle, and Pooh Bear unfortunately forgets. They're waiting, and enough time has passed that he forgets why they've set out the jar of honey. And all he sees is a jar of honey, so he decides to go eat it, gets stuck inside the jar, and then Piglet, of course, thinks that there's a woozle in there, and all chaos ensues. So forgetful types, the ones who don't have effective working memories, that really needs to rely on repetition and consistency. So creating the routine is really going to help those kids. Doug the dog is from that, I think it was a Disney Pixar movie, Up. Do you guys remember that movie a couple years ago? Really good movie. And Doug is easily distracted. So he had that collar that made him talk, and he would be running down the road on their trail, and all of a sudden see a squirrel, and he'd go, squirrel, and then he was off, right? So very easily distracted, very, very poor self-regulation. So dogs, what they need to do is they need to learn to set emotional boundaries. And again, with the rewards and consequences and the use of incentives, that's really going to help Doug stay on track and stay motivated towards their goal. If you give Doug, you dangle something in front of Doug that's more attractive than a squirrel, that's going to help lead him away from that. So you need to figure out what that is that's really going to motivate him to look past that squirrel. Hi-ho, this is a reference to Snow White and the Seven Dwarfs. And I call this the big picture type. And this again is kind of thinking about long-term goals and breaking down those goals. So big picture types really don't have the ability to break down those goals. And they get very, very overwhelmed with, say, a long book report or a big test to study for, because it just seems like one big, huge task. So in the Seven Dwarfs, what happens is Snow White comes and their house is a complete mess. And I like to think that it's because they were big picture types and they just saw this huge mess and it was way too overwhelming to tackle. So what Snow White did is she said, okay, Dopey, you wash the dishes, and Doc, you sweep. And she gave them each a different task. And when they only had one simple task to follow through, it wasn't as difficult. With kids, I often, this can be in terms of breaking down a report and just giving them one small step at a time. Or I will even suggest, if they have, say, a worksheet that they need to complete, cover up everything except the very first line and say, don't worry about the worksheet. I just want you to do these 3 problems. And that usually can kind of help them get started. And then again, when they get started, it can become easier. And then sometimes we have perfectionists. The kids that won't do anything because they feel like if they can't do it 100% perfect, that it's not worth it. So I call this the ABD or all but dissertation. So you hear about these people who, and I knew some in graduate school working on their dissertations. They did really great all through grad school, straight A's, and then they just cannot complete the dissertation. Sometimes it's because they don't have that ability to self-regulate. Sometimes it's because you have well, not unlimited amount of time, but a very long amount of time to get it done, they don't want to stop until it's perfect. So you really need to learn to set limits there. Other things that can help is the incentive system. Create an incentive system for yourself. Say, if I get this piece done, I will reward myself this way. And then time limits, really limiting yourself in terms of time. I just wanted to mention a few time management devices that I find really effective. The first one is the quarter-hour planner. This can be done paper and pencil, or you can even do it on Google Calendar or Outlook, different ways that you can do it. And I have kids that prefer both. Again, you really need to pay attention to the type of learner that kid is, because certain kids are going to do well with some and not with the others. But the reason that these are so helpful with people with executive functioning is because it creates a visualization of time. Those planners that they hand out in the schools that have kind of a, one block, and you're just supposed to figure out all you need to do. Well, it's great for recording your assignments, but it really doesn't tell you where you have time to fit that into your day. And especially with our kids today being so overscheduled in so many activities, and they're not even getting home, until really late in the day, they need to be able to figure out when they can do what. So this is really helpful in that sense. Breaking down long-term assignments and saying, I have a half hour here. I can, write my outline. I have an hour here. I can work on my first paragraph. Things like that. And then what I suggest people do in terms of learning how to prioritize, because sometimes we just assume that people will know what their priorities are. And kids, a lot of kids don't really understand this. I'll have kids who come in doing, a math homework that is worth, a very small percentage of their grade instead of a huge project that's worth 50% of their grade. So they're not sure what to prioritize in terms of what needs to be done first. So I suggest what they do is they make a little legend for themselves. And they keep that legend in the front of their planner, and they pull it out whenever they're making decisions about what item to do first. This is just an example of what one person might say in terms of that. So, and the priorities can be 1, 2, 3, 4. I have kids use those little star-colored stickers. So they have gold as, number 1, silver, red, blue, things like that. And a top one might be something that's due in 1 week or less, or my teacher expects me to complete it ASAP. If it's not complete, I could get a failing grade. So that's a high priority item. This task is due in 2 weeks or less, or a classmate has expressed that he would like to see the results soon. If not completed, my classmates will be angry. So this one, doesn't necessarily hinge on the grade, but it could damage some friendships that are really important. Task is due in 3 weeks or more, or it is something that I would like to get off my plate. If not completed, I will be disappointed. So this one's not really affecting anyone else or the outcome, but it might be damaging to my self-esteem. Task has no pending due date. It's something that would be nice to have done at some point, but if it's not completed, it's okay. No harm done there. So this can really give kids an idea of the importance of particular items. Okay, just one final section here, and I'm not going to go too in-depth on study strategies, because really what study strategies comes down to is the individual learner. For example, we'll have visual learners using graphic organizers to structure things. So you really want to pay attention to the particular learning profile of the child when deciding on learning and study strategies. But some of the questions here are the notes your client takes in class not very helpful to her later? Does your client have a hard time figuring out what to include in her notes? Does your client read something and then quickly forget it? Can your client read a chapter several times without it really sinking in? So these are kind of working memory. Does your client study for tests or prepare for presentations but then go blank when it's time to recall the information? Does your client feel overwhelmed when he starts to study or complete an assignment and doesn't know where to start? Does your client feel she spends way more time than others studying or preparing, or none at all because she has given up? So also in these questions, we're starting to see the toll that executive functioning can really take on a child's self-esteem. And in my work, I see a lot of comorbid anxiety and depression and other issues with things like ADHD, because these kids have really struggled and they don't really know what to attribute their struggles to other than a lack of intelligence. So it's really up to us as professionals to kind of educate our clients on executive functioning, on the disorder, and explain that it is completely unrelated to intelligence and that their brain just thinks a little bit differently. So as a professional, it's really up to me and up to us to figure out coping skills for our clients to kind of, circumvent the traditional routes that are set up in the school. We teach kids all to kind of attack things the same way, but they all learn very, very differently. And we know that things like ADHD, they have very different types of intelligence and ways that maybe aren't traditionally valued in schools. So we really, really need to help educate our clients, because I think that one of the most damaging things that can come out of this is kids growing up with a damaged sense of self. So I just wanted to mention this study just so we have kind of a basic understanding of what these are as the top five strategies that some college students said that, with ADHD, said that they found to be helpful. Number one is working longer and harder than other students. I always have kids coming in wanting to figure out how to, do things to kind of make it easier and shorter. We can do that in a lot of ways. We can definitely teach them some skills that are going to help them make the process a little bit easier. But the bottom line is they probably, when it comes to tasks that require a lot of executive functioning skills that they don't particularly have, they're going to just have to work a little bit longer and a little bit harder sometimes. So being able to understand that and accept that is going to be helpful. Social support. So again, you don't necessarily always think of this as a top five, but here this was number two. You would think it would be more, being organized, like number three. But social support can be really important. We have a lot of groups. The DC area is filled with groups like CHAD and other organizations that can be really helpful to these families. Being organized, managing time, using good study skills. Exercise. We know that exercise is just as effective as medication. So if we can just get more kids moving, we could be dropping off all of these meds. So we're really encouraging kids to do that. And then keeping a positive mental attitude. Again, this is where I think we really need to be really vocal with the families and help them to understand what these disorders really are, what it does and what it doesn't mean for them, so that they can keep their self-esteem intact. And parents can be less frustrated too. And the single best predictor of doing well in college classes was whether the student went online a week before class and opened the syllabus. Why do you think that is? Planning ahead? Anything else? Previewing what's important, so learning the priorities. Any other ideas? These are all right. Organizing time. Knowing what books to get. Yeah, knowing what a class entails and just getting rid of it if it's not something they think they can handle. Getting started, yeah. I mean, essentially, what this is saying is that the more diligent you are about being proactive in taking control of your academics, the more successful you're going to be. You're going to plan your time better and be proactive and get the right books and all those things. So just being diligent and proactive. So real briefly, I just wanted to talk about some additional means of support. I wasn't sure if anyone here was in a position to need to be referring to other professionals if they're seeing some of this stuff, but it might not necessarily be in your line of work to address some of these issues. So things that we know, medication is really the most rigorously studied treatment method for dealing with these disorders, especially ADHD. There's a lot of validity for it. However, what we know is that the most successful treatment is when medication is combined with another sort of therapeutic intervention. Now, when it comes to those therapeutic interventions, it's important to understand that if the client is dealing with the executive functioning difficulties I've been talking about, you don't want to refer them to, your kind of traditional psychoanalyst. We know that the traditional talk therapy is, while it can be really helpful for kind of the emotional component, is not very helpful in changing the behaviors. So you want to be looking for someone who specializes in more of a cognitive behavioral approach, and even more importantly, probably a specialty in that particular population, because cognitive behavioral therapy also varies widely. There's people who do that with depression, there's people who do it with ADHD, and other things like that. When it comes to social skills, there's lots of social skills groups. We unfortunately have learned that sometimes, especially with ADHD, that those kids will do really well in the groups, but it sometimes doesn't really, isn't generalized, and it isn't as apparent when they kind of leave the group. So that's kind of, can sometimes work. Exercise and nutrition, as I mentioned before, exercise really effective. Coaching, now you've heard me talk about coaching a couple of times, and that is really what I advertise my services as. I'm a clinical psychologist, so really it is a cognitive behavioral therapy type of thing, but we call it coaching for a couple of reasons. One, it's really heavy on the behavioral side in making these changes. And two, like a coach, we're really there to help teach, guide, educate, really give the skills and help. So I talk to kids and I say, think about your athletic coach. What are they doing? Well, we're kind of doing that for your academic life and your social life and your life at home. So a lot of kids too will buy into treatment a lot easier if you call it coaching and not therapy. Unfortunately, we still have a little bit of that stigma. So kids are a little bit more willing to play ball, and parents, So accommodations, I know we've talked a little bit about that here today. Things like 504 and IEP, really helpful to these kids. And then multimodal treatment. As I mentioned, medication in conjunction with some sort of behavioral treatment is usually going to get you the best outcomes. So I touched on cognitive behavioral therapy, and what that really means is changing maladaptive thought patterns and really seeing the connection between our actions and our thoughts and our emotions and tying those all together. Mindfulness meditation is a way to help increase focus, actually. We have some fancy things out there too, things with computers, more and more. We have cognitive working memory training and different things like that can help. But if you want a kind of inexpensive way to do the same thing and increase focus for these kids, mindfulness meditation has proven to be just about as effective. So it's not so much about clearing your mind as it is about learning to kind of have an intentional anchor. So anchoring that intention. And then letting go of distraction, learning how to deal with distraction, kind of accepting it and letting it go, and then refocusing. And that's something that a lot of cognitive behavioral therapists are able to do with a client. So again, I just have a little bit about coaching. It is a validated and empirical method that we're using now. There's a lot of definitions of coaching out there, and there's a lot of people doing coaching. Unfortunately, there's no real regulation on it as a field yet. So you just really need to be mindful of who you're referring to and what their credentials are and what their background is. We all have different techniques. And again, it's really behavioral. It's about setting concrete, realistic goals. And we deal with a lot of aspects of the life. I know I focused on a lot of individual skills here, but we also deal with things within the family and helping parents to reach their goals too. And then I just have a list here. If you're kind of, just breaking into learning about some executive functioning issues and you want to learn a little bit more, here's some books you can check out. So I think I've left a little bit of time here for questions. Does anybody have a question? Nobody? I was that thorough, huh? Yeah. I'm familiar with a lot of books on not executive functioning in general, but a lot of ADHD books for children, and then like the autism, Asperger's kind of spectrum kids. There's some by Kathleen Nadeau and Rady that are more towards ADHD kids. Kathy Cohen is in this area, and she's written a couple on the spectrum kids and helping those children. Yeah. Duration in terms of weeks. I always get asked that question, and I wish I had an easy answer for you. We meet with our kids once a week for an hour session. And the duration of treatment really depends on a couple things. One, it depends on the kid, how motivated they are in the treatment, and how quickly they work towards achieving their goals. And then really the complexity of their goals. So in general, I would say the younger the child, the quicker they kind of get out of there. Because really the younger children mostly just really need to learn how to use a planner, how to organize. Things like that. The older kids, and especially the longer they've been dealing with some of these struggles, the more complex it becomes. And a lot of times as we're starting to work, we realize there's a lot of self-esteem issues involved and things like that. So we're kind of working to deal with that at the same time, and it might delay. Anyone else? Okay. Thank you.